to remove the skin from the upper area and the arms. So the first thing that you're going to do is you're going to make an incision in the chest of the cat. Now remember, the skin is very thin, so you don't want to cut into the muscle. And just in case you do, we're going to make a very small incision, and you want to line it up so that from that incision you would be moving over toward the middle of the arm of the cat. So right about here, just going to make a shallow incision. So you can zoom in very tight here and see that the incision is not very thick at all, because the skin is not very thick. So we're going to put you should be able to put the probe in here through the incision, and you should be able to move the probe over toward both arms. But the first pathway that we're going to clear up is going to be up toward the neck, and you'll notice that the neck has already been opened up because this is where they injected the latex into the blood vessels. You should be able to get your probe to come out by the neck area, and then after you do that, you're going to remove it and take your scissors to make your incision. Remember, always have the pointed side down when you're making your incision. Always lift up, and then as soon as you have an incision that's wide enough, you can look underneath to make sure you're not cutting into the muscle of the cat. So you should be able to put your finger in there and then see the pink muscle underneath there. You just want to be able to just feel the skin. It should feel nice and smooth, no muscle tissue or anything in the way. And you're going to cut up toward the neck. Okay, now you've opened this area, and sometimes right up at the neck you have to again use your scalpel because it seems as though it's pretty tight there. I'm going to be pushing all of the muscle down toward the cat up to the shoulder region here. Okay, and clearing the skin from the shoulder. Okay, we're going to go just a little bit further down here on the chest by probing first to make sure you're not going too deep, and then taking the scissors and cutting another inch or so. Make sure you lift up so that you're sure that you're not destroying any of the muscle. Okay, then as you pull the skin away, you just push with your fingers the muscles down toward the cat. And you should begin to see the lines of the chest muscles. Okay, we're going to use our probe now to make a pathway for our incision down toward the elbow. So after you've made a nice pathway with the probe, you can take the scissors with the pointed end down. You should be able to cut through the thin skin and then open it up, pushing the muscle down toward the cat. Okay, now I've made my way toward the elbow. And I'm once again pushing the muscles toward the cat. Looks like there's a little bit of fat on the skin here. I'm just going to push through that. There's a muscle that goes from the chest of the cat over to the arm, and it's kind of extends down from the arm, so you want to make sure when you get to that area that you're pushing upward here as you're dissecting so that you don't lose that muscle. And again, your good check is that if the skin is coming off perfectly clean like this with no pink muscle attached to it, you know you're in good shape. All right, now I'm going to extend my skinning up toward the paw by pushing my probe in here. I want to be able to get the skin off right up here to where the wrist bones are on the cat. Sometimes you have to do this in sections, so I've cleared off a small amount right there, about 2 inches worth, and now I'm going to remove the skin from this part, again pushing the muscles down. I want to use my scalpel as little as possible and try to use my hands as much as possible, so I won't do that much damage with them. But sometimes you get to an area like right here where it doesn't seem possible to use your fingers, and so you'll have to take the scalpel. But when you're using your scalpel, make sure that you're going as close as possible to the skin. Just cut a little tiny bit at a time, and make sure you're not cutting through anything, any of the pink tissue, because that would be the muscle. Okay, I'm going to take my probe, see if I can go a little bit. It's considerably harder to get the skin off of the arms than the legs. That's why I usually start with the legs to practice with. The chances are you will be able to be successful there, and then you'll have the technique down when you come up to the arms. Okay. So there, I've made it up pretty much as far as I want to go here. Again, I'm going to have to use the scalpel a little bit here. I'm going to be really careful so that I'm only cutting through this white fascia material, not through any of the muscles that I want to dissect. Okay, now I want to do the same thing that I did with the foot. I want to get through here so that I can remove the fur so that only the little hand area is covered with fur. So I'll take my dull probe again and see if I can work my way through to the other side here. Maybe I'll cut a little bit as far as I've gotten. Okay, there are a couple thin nerves and muscles right here on the top of the arm. I'm going to see if I can loosen them up a little bit. This pink material here, this would be the muscle. I want to make sure that I push that down. And there's a nerve right there. That white cord is a nerve. I'm going to keep that. Now I can see that I've got a little bit of muscle attached to the skin here. So I want to carefully cut to remove that and push it down onto the arm. Alright, so this arm is done. The skin looks just nice and clean. The muscles should be on the cat. Now I have to do the other arm and the other side of the chest. Okay, up by the neck area, probably going to have to do a little scalpel work. Again, trying to go very, very close to the skin. And pushing the muscle down.